So, hi, I'm Dr. Tiffany Meyer, pediatrician,
And I am Beth Bostwick. I am a family nurse practitioner.
and let's see, I have two girls, ages 12 and 9.5.
And I have twin boys that are 7 years old.
All right, so we're coming to you today to discuss toilet training tactics, and we're social distancing, and we're gonna remove our masks. So, toilet training can be an exciting adventure. It can be a frustrating adventure, but we're going to try to give you some advice and some ways to kind of help your children through this. So, just a little bit of background to start with. Toilet training is accomplished when a child is able to sit on a potty chair or sit on the toilet itself. Um, and usually, technically, potty training is for bowel and bladder function during the waking hours. Nighttime bladder control, of course, takes longer, right? Because the child has to have the ability to wake up, to realize that they need to go and wake up. So that does take a little bit longer. But daytime hopefully is accomplished earlier than nighttime. Interestingly enough, the average American family begins toilet training around the third birthday. So the third birthday is kind of this milestone, but there are many things you can do before that to prepare your child. And about 2/3 of children are toilet trained by their third birthday. So kind of an interesting thing, but we'll go through some of this. And just keep in mind, 10% of children, even by the age of 6, wet the bed. So there is some variation in all of this. And there is no hard and fast rule when you necessarily need to begin, but there are some cues which we'll go over, and there are some ways to prepare for this.
So, some benefits of toilet training is really it's good for everyone. Everyone needs to be toilet trained at some point in their lives, unless you have a reason that it's not going to be successful. More medical in that regard. Um, the Some benefits obviously are that you get less rashes, less diaper rashes. It obviously frees up a lot of parent time, so you're not constantly changing diapers, and it obviously saves a lot of money. Diapers are very expensive, so that can help financially. Also, it opens up opportunities for travel and new babysitters and daycares and preschools. I know a lot of preschools around here require your child to be potty trained before they'll accept them. So obviously getting them potty trained can get them into daycare a little bit sooner if you are able to do that. Um, and then obviously using the toilet helps the child become more independent. They have a sense of mastery, increases their self-esteem. They know that they can do this, and obviously prevents them from getting any additional skin rashes. Um, it's also so a reason that a lot of times that toilet training can be postponed. So sometimes parents hold off on doing it, really because they're too busy. They have a limited amount of time, especially in the home. They don't maybe have the resources to help them train their children. They don't have with two dual career families, it's very difficult
Mm-hmm.
to find the time to be
Right.
able to devote to potty training, because once you start it, it's very important to stay consistent.
Right. And frankly, sometimes it's convenient, right, to have your child, if you're on a trip and you don't have to stop as much if your
Yeah,
child's in a pull-up or a diaper. Um,
exactly.
so how do you know when your child's ready for potty training, right? So some of the big cues, or how do you know when it's your child may be ready for the potty? So in general, just to let you guys know, bowel and bladder uh, function basically needs to be kind of in there for your child to be able to start potty training. And most children become bowel and bladder ready by the age of 18 months, but most 18-month-olds are not toilet trained, right? So just physiologically or biologically, their bowel and bladder function, which what this means really is that they're mature enough to be able to delay a bowel movement or delay urination long enough to get to a potty, right? So about 18 months that's the case, but that doesn't mean that they're necessarily going to be toilet trained by 18 months. And studies do show that more than 90% of children show signs of readiness between 18 and 30 months. So that probably is the best time to think about it, 18 and 30 months, so which is 2.5 years. However, they're not usually cognitively ready, which means they're not thinking about this. They're not able to really process this until about the age of 2 years. This means that they are not able to associate the need to urinate with the potty, right? So they don't necessarily realize, I gotta go, so I need to go to a potty. Or they may not remember to use the potty. Or they may resist, they need to resist distraction long enough to complete the process, right? Because they may get to the potty and then they're distracted and they jump off the potty before they use it. So that's the thinking part, the cognitive part, that they're not may not be ready yet. And then another cue that they're ready are motor skills, right? They have to have the ability to get to the bathroom, take off the clothes, and then sit on the potty. So they have to be able to, climb onto the potty. You have to take off the clothes, climb onto the potty. That is another thing to look for. Are they ready to use the potty? And then the emotional urge to it. So are they showing signs that they want to be more independent, or they want to master, like have self mastery, or want to master this task? That's another thing to look for. And then the social readiness. So they have to be aware that others use a toilet and that they have to desire to kind of imitate that behavior, right? So they are aware that, oh yeah, daddy goes to the potty or mommy goes to the potty, and I want to do that too. And then one of the last factors is the verbal ability. Can they understand when you explain to them how to use the toilet, right? And can they communicate to you when they get frustrated or confused, right? So all those kind of pieces ideally should be in place. They may not all fully be in place, but those are some cues to kind of know when your child's ready to use the potty.
And leading right from the verbal ability of the child, it's very important to prepare your children for potty training. So the vocabulary that you use, the verbal cues that you use, is really important. Calling, using pee and poop and potty and all of those simple
Right.
terms should be consistent and should be talked about frequently, especially prior to actually implementing the training time. Then make it very, I would say, normalize potty training.
Mm-hmm.
So everyone poops, everyone pees.
Animals do it, right?
Animals do it. Point
Right.
out that, dog's pooping in the yard again.
Right. Right.
Simple
Right.
things like that.
Exactly.
That everyone does this can certainly calm the child. That this
Mm-hmm.
is not an anxiety thing. This is should not invoke
Right.
anxiety. It's something that's very normal. It is, and it's that your body's way of eliminating fluids and things that it doesn't need anymore. So
Right.
your body wants to make poop. It wants to make pee, and
Right.
this is a very normal thing.
Right.
And praising your child, I know this sounds kind of funny, but to praise your child for even going in the diaper sometimes can you're correlating with them the knowledge that they have done something and making them recognize that they have done something. So
Right.
pooping in the diaper initially, especially at or by the 18-month mark, you're just talking about it. So you're
Right.
just trying to get them to understand you're pooping. This is you pooped
Right.
in the
Right.
in your diaper. This is
Right.
okay. And but don't and try not to refer to the pooping as dirty
Or
words,
a negative thing, right?
negative,
Yeah. So dirty,
caca,
like
dirty, yucky,
yucky. Yeah.
things like that. Making your diaper changes, when you do change your diaper, making it as brief and boring as possible. Like you are in and out, no playtime. Don't let them run around
Right.
naked unless you absolutely,
Right.
if that's something that you
Right.
are doing.
It's
Um,
not a game,
it's
right?
not a
You
game.
don't want to turn to a fun activity and then it gets reinforced.
Exactly. Trying to change the child's diaper as often as you possibly can, which obviously it creates more effort on your part. More time is needed when you have to change the child often to keep them dry, but keeping them dry as often as you possibly can is best. Um, and also teaching the child to come to you when they go to the bathroom or even in their diaper. So when they're wet or when they are pooping, that they are coming to you and letting you know that that this has occurred. So it's once again just making that communication very open, and you're talking about it all the time. Um, yeah. So
And we have a question that we'll answer shortly too.
yeah, just
Okay.
exactly. In initially, I know this might sound really awful for some dads, but even for male adults, it might be best to show them by even sitting to pee.
Right.
Boys, you can teach that skill later. Once
Right.
they have got the concept that they need to
Right.
pee and poop in the toilet,
Right.
sitting down is easiest, even for
Right.
boys and girls alike. They should just probably sit. And sometimes, if the men can get involved, and if mom, dad are around, and
Right.
our children are watching us, that having the men sit down too can help. You're just giving them, the visual cues a little bit easier for them.
And standing unfortunately can turn into a game, right? With for males. So the sitting is the best way to start.
To
So.
Yeah, to have that yeah. And obviously buying underwear or things like that, and talking about big boy, big girl underwear,
Oh.
just your big kid, your underwear, talking about those things, it motivates them. Buying them, showing them, and let them pick them out their own, cars, or
Right.
Star
Right.
Wars, or
Exactly.
whatever,
Is a motivating
a
factor.
motivating, yes, like, yeah, you want to, wear these types of things. So teaching them that they are talking about a potty chair, or
Mhm.
using a potty
Yes.
chair is also good, and keeping it around. I think some people really are very motivated on getting onto the toilet. Well, the toilet sometimes is very scary for a
Right.
toddler, so getting them their own chair, it's also easier to bring it to them. So
Right.
if they are at the train table, or they're at the art
Mhm.
table, and they're doing something, you can take the potty chair
Right.
to them,
Right.
and making the potty chair kind of part of your daily life in the
Right.
beginning, and talking about it, and using it, and
Right.
sitting down on it, even for play, letting the child play, sit even with their clothes on.
So they get used to it.
Right,
Yes.
so they get used to it.
And the potty chair can be it's obviously it's more convenient, right? So and it can be less scary, right?
Right,
Because some kids it's scary to sit on a toilet if
toilet,
it's high up. So.
exactly. So yeah, and you can give them a sense of ownership, that this is my chair, this is where I go to the bathroom.
Right.
You go to the bathroom in the big toilet, I go to the bathroom in my chair.
Right.
It's a
Right.
privilege. It's something
Right.
special for them.
Right.
Um, and obviously, just to generate curiosity of going to the bathroom, I think that having kind of them aware that mom and dad do it,
Right.
siblings do it,
Right.
letting the child watch another sibling,
Yes.
kind of, that's family,
Family preference. Yes.
preference on that. But,
Right.
child, and also just reading toiletry books,
Right.
um, just prepping your child, talking about it, being open, normalizing it, and
Right.
that all begins way earlier than they actually probably indicate that they're ready.
That's exactly right. So
So,
you can begin this, as early as 18 months and maybe slightly bit earlier, just discussing it and prepping for it, right? And even dumping the if the child goes poop in the diaper, dump the diaper into the toilet because that's where it's supposed to go. Just kind of letting them know that that's where they should be
where it
going.
goes. Exactly.
And so the next thing we wanted to talk about is kind of creating a toilet training plan, and we've kind of discussed some of this already. But be positive, right? No negative words about urinating or pooping. But children learn behavior when they are praised for their progress, right? Versus being punished for mistakes. So everything should be positive, right? And I know nobody's 100% perfect, but try to stay on the positive side, right? To praise when they do something, they use the potty. Um, if your child progresses and does pee on the potty, obviously giving them a hug and praise. And it's up to the family if you want to do a tangible reward like a sticker or an M&M or something to encourage your child. And you know your child's best, what motivates your child. But and then when he or she fails, tell them, be positive about it. You're sure next time it's going to go better, right? Not punishing them for doing it, right? So you don't want to turn it into a punishment kind of thing. And of course, this makes sense in every situation with young children, but be consistent, right? So create a reasonable expectations for them, based on what your child can do, and express them clearly and frequently. I want you to sit on the potty and use it, right? And try to have them follow this on a regular, on every time you do it. Keep the bathroom routine as consistent as possible, right? So if the potty, keep it in the same place, right? That's one thing to think about. and that the same sequence of actions, right? So including, after you use the potty, you wipe and then you wash your hands, right? So it's a routine. Get into a routine. And you may also want to say, when we wake up in the morning, we're going to do this, or before we go to bed at night, this is what we do. So put it as part of your routine and be consistent. Um, and the big thing too is make sure other caregivers, right, are consistent. So, mom, dad, grandparents, daycare, whoever needs to also be as part of your plan. And another part of your plan should be staying involved and observing, right? So very young children, their needs, their behaviors, their abilities change, right? They may regress a little bit, they may, and we're going to discuss that a little bit further, but they can be unpredictable. One day they want to use the potty, next day they don't want to use the potty, right? So you need to be adaptable with it, and your approaches need to change kind of with time. They may seem to master the skill, and they probably have, but then they temporarily disappear because something new is in their environment, or something stressful has come along. So just keep that in mind, that things do change. And then the last part, enjoy. Not that you're going to make a game of it, but there are all these fun books to read, there's videos, there's Elmo, there's all this stuff. It's a necessary chore, but you can have some fun with it. There's some fun at times. Enjoy the charming, funny moments, right? Take pictures if appropriate, and so that's just part of the plan. So.
Exactly. So some common errors that can occur in potty training. Number one is that the parents um, commonly don't they do kind of nothing. They let the child indicate to them that they're ready, or their desire to train. But knowing that it's coming, it's a lot easier for you as the parent to prep everyone, knowing that it's coming, than have you get into a situation where it needs to be done. So doing kind of just waiting and kind of putting it off sometimes is not really best, because then there's a lot of other emotional factors that go into it that makes it unpleasant and more anxiety producing. So um, there's usually some cues that a child's ready. I think just being aware of those cues, and then being able to capitalize on knowing that those cues are there, and then starting your training plan, which Tiffany just Dr. Meyer just discussed. Um, so yeah, exactly what I just said. Preparation takes many months
Right, and
prior.
obviously, again, this is kind of repeating ourselves, but being consistent, right? Making sure everybody else that takes care of the child
Right.
is in on your plan.
Right. Even
And
daycares,
right,
even
right,
babysitters,
right,
anyone who has care of the child that has to be involved in this, and
right,
that goes to even the verbiage that you use. The vocabulary that you use should be
right,
consistent throughout,
right,
because you don't want the child to be confused
right,
when, grandma uses a different word and you're using these words.
right.
So,
Or grandma may be more negative about it than you are, or you're
right,
more negative than grandma. So try to be consistent.
right,
And the biggest thing is preparing, right? As we discuss this, it's not something you can say, okay, this weekend we're gonna be potty trained, and you hadn't discussed it or prepared, before this at all.
right,
So it's a bit of a long haul, but it's something that you start early, when the child, you're not quite expecting them to use the toilet yet, but you're preparing for them to use the toilet. So.
right,
And so regression, right? Many kids seem to master toilet training, and then they regress, right? And so what's going on here, right? So this could be, this it's very common that kids do regress, and in your heart of hearts they can use the potty. They've done it many times, and then they stop doing it, or they have an accident, and this can happen when there's a change in their routine. So they may have a new babysitter. They're starting in a new room in daycare. They're starting a new preschool program, right? So stress in their environment can come out in their potty training, right? So and obviously be aware of it. Take a step back. Oh, why is he having this problem? Oh, I know why now, because he's in a new room at daycare or something. So a mom's pregnancy or the birth of a sibling obviously can cause children to regress. A major illness on the part of the child or a family member. So a family member might be sick, or the child has been sick. A death in the family or a recent death may cause the child to regress. Marital conflict, parents divorce, or parents just fighting might cause some regression. An upcoming event or a recent move, right? A move to a new house, it's a new environment, the child might regress a bit.
yeah,
So just be aware of that, right? If there is a regression. and how do you get them back on track, right? So identify the problem, right? Be aware of it. It's difficult for young children to realize that and verbalize that, right? So
Yep.
just be aware of it yourself. Let your child know that you've noticed that there's a change going on. Don't ignore it. And then maybe ask them. They may not be able to tell you, but ask them why they think this might be, and then try to kind of solve some of that. Did you move the potty to a new bathroom, right? Are they worried that the toilet at daycare is going to be scary? I mean, there's something going on there, and try to figure it out. Maybe the new baby is getting lots of attention because they're changing the baby's diapers, right? And so realize that, and maybe take some time to spend with your toddler alone while the baby's sleeping. So maybe they'll go back to being the big sibling and not wearing diapers. And obviously listening to your child, right? And try to communicate that these events can be upsetting and you understand and you're going to get through it. So trying
Yep.
to be positive about it. The next kind of piece is sympathizing, right? And this is kind of the same thing. You've identified it, now you're sympathizing. So let your child know that it's hard. You understand that it's hard to sometimes stay on track. And let them know that this happens to lots of kids. You're not the only one, right? Make it clear that it's normal to feel scared or disoriented when they're in a new house, a new room, something that's causing this regression. And let them know it's going to get better. These feelings will go away. You're going to get better. And then, of course, do what you can to fix the problem, right? So arrange maybe for a special time, as we said, for a special alone time that you give your toddler alone time if there's a new sibling in the household. And then take as they go to daycare. Like on a Monday or the next week, I'm going to go with you and we're going to figure out what's going on here and try to help you. So and obviously be consistent again, right? All family members should
Yep.
be doing the same thing. And a great thing, depending on the age of the child, and some children are more verbal earlier than others, but ask your child, how do you think how can I help you, right? And they may contribute something that you didn't realize that they know how to make things better. So, just, be aware of it, and then be clear about your expectations, right? Try to remain calm. I know, but you get frustrated when these things happen, especially in environments where you're away from home. But try to remain calm, and just kind of be there as a support for your child, and positive reinforcements, right? The hugs and the praise when they're doing the right stuff, and trying to, if it's not going right, say it's going to go better tomorrow. Tomorrow will be a better day. And if the accidents continue, right? Just keep this in mind. If it goes on for a while, maybe your child's really not ready for potty training, right? So, and you don't want to get in a battle with it, right? It shouldn't be a battle. And if it's just something that you kind of have to be flexible again with, right? So try to adapt to the situation. And we did get a question here about a toddler who is pooping in the potty but does not want to pee in the potty so much. And kind of going through some of these things that we've talked about, and obviously every child is different, right? Every child's going to have their strengths and weaknesses and their abilities to do things. Maybe they're better at pooping in the potty than peeing in the potty. And again, trying to as much as you can, try to figure out what may be going on in the environment. Not to get in a battle too much, but reassurance and positive praise when they do use the potty, and maybe having obviously the parent modeling the behavior too, and seeing if that will kind of help too.
Yeah. I'm going to clarify the question, because the question was that he was peeing, but then 5 minutes later he was peeing in his pants, or
Yes.
in his underwear.
Right.
So he'd go, I guess, pee and poop, but then
Right.
5 minutes later he'd pee again in his underwear.
Right.
So, I don't know how, sometimes I think that can be, I, I don't know, I feel like at that point I might consider talking to your pediatrician
Yeah,
about that.
I do think that could be a conversation with a pediatrician, because and of course we want to know the ins and outs and what's going on in the environment, and is the child, and sometimes children have strong personalities, right? They'll do it on their time frame. That your child's not ready at this time, but will be ready when he or she's ready. But there are other things that you can support your child and ways you can kind of improve stuff. So, but I do think that's probably a kind of something that does warrant a visit with a pediatrician or even a telemedicine visit.
Yeah, and I would even follow up with that because I would want to know some additional information about that, like how are we reacting to him having the accident?
Right.
There could be some a little bit of tension going on if it's
Right.
consistently happening. It can be very frustrating.
Right.
So I don't and it may be some negative attention seeking too.
Well,
So
that's right. So
there's
if
some things that I'd like to probably tease out
yeah,
with that question.
that's a conversation that we with the parent that we can have and discuss what the specifics of what's going on. Sometimes kids are very even negative attention. They want that negative attention if they're not getting what they want. So sometimes kind of breaking that cycle and trying to praise the positive and ignore some of the negative if it's not the positive outcome you want.
Yeah.
And then we've got some questions about overnight nighttime training. So obviously every child there's a spectrum, right? Some kids automatically kind of train themselves at night. They're dry at night and you're like, wow, this is amazing. And other kids maybe 6, 7, 8, 9 and they're still kind of wetting at night. That is actually kind of a whole conversation in itself. But nighttime wetting can be related to mom and dad's history too. If they took a long time to train overnight, it's very common that a child will also. But some things that you really can do is cutting off fluids, right? So a child who drinks a lot of water up into bedtime may really still go at night. So I know it's super hard, but trying to cut off fluids at dinner time, depending, I know when children go to sleep, sometimes they go to sleep shortly after dinner.
There's also been some correlations with juices and sugary drinks.
Yes.
So limiting those, especially, maybe
Absolutely.
if you are a juice family, having, your 4 or 6 ounces early in the morning, but
Right.
nothing after noon,
Right.
can certainly help some of those nighttime weddings. I
Absolutely.
also, same thing, we kind of also discussed this, that it doesn't, nighttime training does occur more regularly later. So the average age is about
Sure.
5, 6, I think,
Yes.
right? 6,
Uh-huh.
8
Yeah.
age. And with my twins, I had one that was nighttime trained at 4, and the other one was definitely 6, 6. So
Right.
I think sometimes we get frustrated with the nighttime. We don't want to embarrass them that they're in a
Right.
pull up or they're in a diaper.
Right.
Um, but I think for our sanity as parents, I would probably encourage you to continue doing a pull up, because sometimes I
Yeah.
think we push the kids, and sometimes there's no reason that it's happening. It really is a
Right.
biological genetic thing that happens. So
Right.
um, yeah,
And sometimes they're very deep sleepers and they
yeah,
really don't realize
yes,
that they're doing this.
correct.
If the child is not wearing a pull up at night and they do have an accident, try to involve your child in the cleanup
Cleaning up. Yep.
process. Clearly, they can't do the laundry themselves at a young age, but they can help you take the sheets off the bed. The more the more of a burden and the more work they have to do is more motivating not to wet the bed.
Yeah.
So have them at least help you take the sheets off, bring them downstairs, that kind of stuff. Don't be the maid for your child. Make sure they're involved in the
They're
cleanup
involved.
process.
Yeah.
And another thing is some parents will do is if their child goes to bed early, then they will try to wake their child up before they go to bed and at least have them pee one more time before the parents
Yes.
go to
Go to
bed at
bed.
night.
Yep. We've done
So
that too.
there are potty alarms. Some people find that those do help. Some people don't. But there are a lot of different kind of ways to approach it. But the best stuff is really trying to get the fluids in earlier in the day and not so much drinking the liquids later in the afternoon and evening. So, um, yes. And so just remember, we are here. Sure, your children are still due for their annual physicals. We are still doing telemedicine for medication checks and sick visits and conferences and things like toilet training are perfect visits to do by telemedicine because we can see your child and we can talk with you as a parent. And it can be a conference visit where we discuss what's going on. So we're here for you and have a nice weekend.
Thank you.
Thank you.